How can a bad eye injection be fixed? I had an injection of Restylane for bags under eyes on October 21st. They look worse now than before injections. What can be done to fix this?
Thank you for your question. You've asked in your question, can a bad eye injection be undone? And you described in your question that you had Restylane placed and now their bags under your eyes look worse. Well, I can certainly assist you with this question. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. I specialize in cosmetic rejuvenation of the eyes, and fillers such as Restylane is something I use every day in my practice. In addition, as a specialist, I also get to see a lot of patients like yourself who come to have their fillers undone because they're not happy with the results. So to begin with, it's important to understand what has happened and differentiate whether or not it's a bad injection or versus it's a swelling as a result of the injection, or whether it is displacement of the material related to the injection. So what do I mean by this? Well, a lot of times when people have under eye bags and they're, for whatever reasons, averse to having surgery, and they want to try a non-surgical option. And this is where a filler does have some potential value, but up to a limit. Now, in those situations, someone can come and have that type of situation and then have too much volume or make their eyes look more puffy. In those situations, we use an enzyme called hyaluronidase. And hyaluronidase is an enzyme which dissolves the filler. Once it dissolves a filler, there can be some fluid as a reaction to the response of the treatment, and then that fluid goes away. So that's one case scenario, and that's a way to undo the filler. Now, if for any reason that filler that the reason where you have the bags under on the cheek area more than the under eye area, if the filler was placed there and if it was placed superficially, then the same solution is also applicable. You can use hyaluronidase and you can literally see the material disappear as you're doing the treatment. You inject and you massage and it goes away, and it's very impressive how much you can get rid of at one treatment. Now, if on the other hand this is more of a reactive swelling or fluid, well, then fluid is a matter of some circulation. Now, if that fluid lingers for a long period of time, then it may be that a couple of things. Maybe the material is placed very superficially, or maybe for you the fluid is a response to the material and it's just not the right material for you. Again, in that scenario, hyaluronidase can also be useful. I find that a lot of times there is a way to actually improve the under eye area without actually directly injecting into the under eye area. We do a procedure called the Y-lift. And with Y-lift, we're using hyaluronic acid filler like Juvederm to restore structure in the face in a way that restores balance. A lot of times people look at their under eye area as the focal point of their concerns, but when we restore structure in the cheek area, the jawline, and the whole facial volume in a way that makes them look more angular, very often the under eye area actually looks considerably improved. So there are many ways to look at the situation, and that could be also an option worth considering. So don't let this one negative perception or experience color you from doing or discourage you from doing something else in the future. But I'd say that if this swelling lasts for a longer period of time, you are probably better off having the material dissolved and starting from scratch and kind of figuring out maybe a different strategy. A lot of times people come to me for cosmetic eyelid surgery after they've had a bad experience with a hyaluronic acid filler because it made them swell some more. And so maybe they were better off having what's called a transconjunctival blepharoplasty and fractional CO2 laser, PRP, treatment, which is typical for what we do in our practice to help people with under-eye bags. But facial aging is a complex process, even though it's based on very simple principles of sagging and volume loss. It's really also an art in how to rejuvenate the face and look natural at any age. So with that being said, I think you should investigate this, of course, first with the doctor who performed the procedure, and then take it from there and maybe entertain some additional opinions to to become more educated about your options. So I hope that was helpful. I wish you the best of luck. Thank you for your question.